Good afternoon everyone. Myself Dr. Dipalee Borade. I'm a consultant radiation oncologist at Apollo Hospitals, Navi, Mumbai. Today I am going to talk on one of the type of radiation therapy, that is brachytherapy. As all we know, the treatment of cancer is with surgery, chemotherapy and radiation therapy. And the radiation therapy is delivered with different techniques. So whenever it is given through externally, it is called external beam radiotherapy. And whenever it is given through internally, or whenever the sources are placed inside or near the tumor, it is called brachytherapy. In Greek, the brachytherapy means short distance. So whenever we put the source near the tumor or inside the tumor, the radiation will be delivered through the short distance and with shorter time. So it is called brachytherapy. Today we are going to talk on brachytherapy in gynecological malignancies. So brachytherapy is mainly used to boost the tumor site with the intracavitary brachytherapy. Intracavitary means inside the cavity. So whenever the sources are placed inside the cavity, it is called intracavitary brachytherapy. In carcinoma cervix, the main treatment is through external beam radiation therapy, which include the primary tumor area plus the pelvic sites. With brachytherapy, we can give extra dose to the primary tumor. So thus delivering the higher dose in very targeted manner. So this is very precise treatment with the targeted therapy. Depending upon the technique used, the brachytherapies are like intracavitary brachytherapy or interstitial brachytherapy. In intracavitary, the source is placed inside the cavity, and in interstitial brachytherapy, the sources are placed through the soft tissues. So we put the needles inside the soft tissues with a particular template, and through that needles we can deliver the radiation dose. Then brachytherapy can be permanent or can be temporary. So temporary brachytherapy means the treatment will be delivered in few seconds or few minutes. In permanent brachytherapy, the sources in the form of small seeds or rice-like sources can be kept inside the tumor tissues, and which will deliver the radiation for next 2 or 3 months. That is called permanent brachytherapy. Gynecological malignancies mainly include the cancer cervix, cancer uterus and cancer of vagina. So whenever we are treating the cancer cervix with external beam radiation therapy, will include the larger area. With brachytherapy, we give dose to the limited tissues. For cervix cancer, whenever we are giving brachytherapy, generally this is a one-day procedure in which we take the imaging, we'll plan on that CT scan, and then we'll deliver the radiation. So the type of brachytherapy which will be used for a particular patient will depend upon many factors, like location of the tumor, the extent of the tumor, the health of the patient, and the preference of the template used. So whenever you are meeting your doctor and you require the brachytherapy, you should discuss these points, means which technique will be feasible for you, and it should be given under general anesthesia or spinal anesthesia. It should be discussed previously, and then only the decision of the technique used will be taken. In external radiation therapy, the sources are kept outside the body, and the radiation has to traverse from normal tissue to the tumor area. That is, the radiation is from outside to inside. But in brachytherapy, as the sources are placed inside the tissue or near the tissue, the radiation will travels from inside out. That's why delivering higher dose to the tumor area and with minimal dose to the normal tissues. Thus, we'll give minimum dose to the normal tissues in brachytherapy. Apart from gynecological malignancies, the brachytherapy can be used at many different sites, like in carcinoma esophagus, carcinoma breast, carcinoma prostate, anal canal cancers, and at many other sites along with the external therapy. At Apollo, we have microselectron brachytherapy machine with 18 channels, and we generally practice the brachytherapy for gynecological malignancies, the breast malignancies, and urogenital malignancies. If you have any queries or you want any details regarding the brachytherapy techniques, you can contact us at Apollo Cancer Hospital, Navi. Thank you.